everyone, greetings for the day. I am Sanya Acharya from beautiful Spotless Skin Team. I am sure all of you must be keeping good health. We all know taking care of your skin is important for more than just your appearance. As the largest organ, your skin is important for more than just your appearance, and as the largest organ, your skin becomes the most essential to your overall health. If you take care of it, it can help take care of you. This is why it is so important to have a well thought out skincare healthy routine. According to a study conducted across 4 Indian cities revealed that more than 80% of the population presents skincare color heterogeneity on the face irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone more susceptible to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. It's a pretty well known fact that you will feel better when you look better. Having a daily skincare routine helps you to look your best and put your best foot forward when you go out and into the world. In today's busy world, cosmetic products are integral part of daily lifestyle. But are they healthy for your skin? So let's connect today with our skin expert, Dr. Sai Swetha, live from Bangalore, to enlighten us on skincare treatment in melasma and hyperpigmentation. Dr. Swetha is a young, vibrant, and highly skilled in the field of dermatology. Dr. Sai Swetha has always envisioned integrating technology with human expertise. That is the niche she has carved for herself in the past 10 years. She is constantly pushing the envelope to stay ahead of the curve so she can provide her patients with the skin they desire. She recently also did a course in aesthetic medicine from the American Academy of Aesthetic Medicine to style her passion for upskilling in an industry that advances every day. Welcome, Dr. Swetha.
Thank you, Ms. Sanya, for the very kind introduction.
Thank you so much, ma'am. So, ma'am, as we talked about melasma, what are the causes of melasma, basically?
So, melasma, as you said, hyperpigmentation. There are different types of hyperpigmentation, and melasma is one such type of hyperpigmentation we see. So, there is a hormonal background to melasma, but there could be various causes like, genetics, there are stress conditions, but mainly there is a hormone pathophysiology behind melasma. And this, as you said, it is particularly seen in the light brown skin types, like which is mostly seen in India, the type 3, 4, skin types. We are like, commonly melasma is seen. And it is definitely common in females. And also kinds of starts up during the pregnancy in many people. So it's also called mask of pregnancy. We do see male cases, but definitely it's more in the middle-aged females. So that's the basic, like if you want to know what is melasma, so that is the basic thing. Like it has a genetic influence, it has a hormonal influence, but sun exposure is definitely the most important role when it comes to melasma.
Ma'am, as you said, we talked about causes of melasma and hyperpigmentation. So are these like different or these are the same? What is basically the difference between melasma and hyperpigmentation?
Yeah, so hyperpigmentation is the word we use whenever there is increased pigment, like there is a little brown patch or black patch or anything, that is hyperpigmentation. So there could be various reasons, like you had an acne mark and then it has left a black, after the acne has gone there is a black, or you had excessive sun exposure and then it has left a mark. So the different types of, or freckles, even they're also type of hyperpigmentation. Anywhere there is a little darker skin, more melanin, it's hyperpigmentation. So melasma is a type of hyperpigmentation. So all melasma are hyperpigmentation, but all hyperpigmentations are not melasma.
Okay. So all hyperpigmentation is not melasma. Very well.
Yeah.
And if I talk about the symptoms, so what are the symptoms and signs of melasma and hyperpigmentation?
Yeah, so hyperpigmentation as such can occur at any age, anybody, any any area of the body. It can occur. It could be like any reason for it. But melasma has a particular distribution and also an age group. So it is mostly seen from 30s to 50 is the age group we see in, and usually it is a centrofacial distribution. We say like cheeks, your nose, sometimes on the forehead and chin, very rarely on you can see on the chest and back and shoulders as well, but usually it is a centrofacial distribution we have for melasma. You'll see pigmented patches on both the sides of the cheeks, a bit on the nose, and the person is usually in the middle age group. Or sometimes specifically they say that it started during my pregnancy and it never went. These are the usual presentations of melasma.
Okay, okay, ma'am. And if we talk about the risk factors of melasma, so what are the risk factors of melasma?
Yeah, so the risk factors definitely excessive sun exposure will be the first thing we have to talk about. And then the second thing would be because sun exposure definitely induces that, if you have even a genetic tendency towards melasma, but again, the sun exposure kind of like, makes it early. It appears 5 years earlier if you're exposed to the sun. And second thing, definitely hormones like oral contraceptive pills or general, natural hormones during the pregnancy or during the menopause or any hormonal supplementation. So all these hormones have a influence on melasma because that is the basic cause. So definitely hormones have an influence. And other than that, some drugs also, are the risk factors and stress conditions. So all these add up to it.
Ma'am, and when we talk about sun exposure, so sunscreen is the most important thing, as you said. So why to use sunscreen, and how to choose a right sunscreen for any skin?
Yeah, so that's like the most important, I think, question of today. Like, why sunscreen and which sunscreen? Okay, sunscreen, yes, because the thing is, whenever there is sun exposure, the melanin production is increased. Already the melasma patches are very active. They want to produce melanin. And then when there is sun exposure, it adds on all that heat, activates them to produce more melanin. So that is the only way to stop, prevent the new patches to come or reduce the ones which are there. Okay, so sunscreen definitely a must. And now with sunscreen, what type of a sunscreen, like how do we decide? So in melasma, it is very important. Sunblock is very important, but then what type? So mineral sunscreens, as we called, which are the physical, sunscreens we say, those are the sunscreens which are a definite must in melasma because we want, they kind of block the sun rays from entering the skin. Okay. Any sunscreens that have got titanium or zinc oxide, titanium oxide, these are the sunscreens we should be looking for because they block the sun rays from entering the skin. Okay. And on the other hand, when you have chemical sunscreens, why no chemical sunscreens? In fact, chemical sunscreens might exaggerate the melasma you have got. It might increase. The thing being, chemical sunscreens absorb the sun rays and they heat up your skin. Like the sun rays have to enter your skin and then the chemical sunscreens absorb. So when they enter the skin, they automatically activate the melasma, more melanin. So physical sunscreens we have to choose. Whenever you have melasma, you should look for mineral sunscreens, which are the physical blockers. That's the best way to start, like while choosing. But also the sunscreen which you're able to use every day, which you're comfortable with, and which you're able to use every day, that is what it counts. Like you need to pick a sunscreen which suits your skin and which you're able to use every day.
Okay, okay, ma'am. And what do you suggest? Should be a daily routine. Perhaps starting from the sunscreen to the night creams, with
Yes.
the the people who have melasma and without people who don't have.
Yeah. Yes. So basically, it should be like always the skincare regime should be like it should be simple as possible. We should try to pack in as much as the hero ingredients into the steps. So sunscreen definitely yes in the morning. So one before that, so you can use a good face wash in the morning and evening. And in the morning, post the face wash, you can have a sunscreen. Sometimes it's best to use a sunscreen which has, other agents which are helping us with hyperpigmentation or general health of the skin. Like, we have vitamin C along with the sunscreen. So you can use a product which has both. So that way it's helping, vitamin C is packing up all the antioxidants. And then we have a sunscreen. So one product, is kind of doing its job, like, in two ways. So something like that can be added in the morning. And in the night, definitely wash your face. Proper cleansing is very important. And then we end up with either active treatment for melasma or any hyperpigmentation. And then always end it with a cream, which is a moisturizer. Definitely. Like that, this should be a basic routine for anybody and everybody to start with.
Yes, ma'am. And as you said, moisturizer is quite important. So, is there
Yes.
any need of using, regular moisturizer, and how to choose the right moisturizer for your skin?
Yes. So again, a very important question, because after the sunscreen, in fact, moisturizer and sunscreen, I believe equally important for, all the patients, anybody I talk to. So moisturizer quite important. Again, it should be something that suits your skin type, and it should also be packed with ingredients, again, helping. If somebody has a hyperpigmentation or a melasma, then the moisturizer should also have things like kojic acid, azelaic acid, something which is also helping with the pigmentation. Okay. In fact, even retinol, which is anti-aging, also kind of helps with the pigmentation. So something, the moisturizer packed with some active and hero ingredients, it's very important. And or if you're acne prone, then you kind of go lighter or gel-based moisturizer. And then which will also help in cutting down the sebum production acne. So choosing a moisturizer is very important, because if it is not right for your skin, you're not going to use it for long. You're going to have some eruptions, there's purging, and then you just let it be, you leave the moisturizer. So a right product is very important in this case.
Right, ma'am. Very well answered. And talking about moisturizer and then sunscreen, and now coming to the night creams. From what age do you suggest one should start using them, and then how to choose the night creams?
Yeah. So night cream, as in, I believe, see, night cream should be ideally a moisturizer. As I said, you can start it as soon as, your teens, you can start up. But then the products which are inside your cream changes. See, when you're young, probably just a moisturizer with good ceramides, a simple moisturizer is good to go. And then later, as the age, you're getting into 25, you can add something like, anti-aging agents into it, or something which will has actors which will help with the pigment, or retinol later. So the ingredients in the cream changes, but a basic cream, night cream, which is moisturizing and helping your skin, can be started, from as early as, the late teens.
Okay, ma'am. And now, ma'am, talking about the fairness cream, would you please talk about fairness cream?
Yeah. So let's say, like, there is like fairness is equal to, beautiful skin somehow. I think many countries, and even in India, it is like, much more prevalent that somebody fair is seen as beautiful. Like, so
Right.
that is somewhere it is changing. It is changing over the years, but there is like, still a lot to go. We are like, far from getting there. So fairness creams, again, no, like things which have been in the market from our childhood, what we have heard, they have done enough damage. Now we are seeing the, all over, like we are seeing the cases of reals melanosis and, ashy dermatosis, where people who have used these fairness creams for long years, they have got black, gray patches all over the face, and it is so tough to treat. It is such a tough thing to treat, and there are not much we can also do about it. So these things kind of have like a, they make your skin quite weak, they thin out the skin, they cause pigmentation. So no, something that claims as a fairness cream, please do stay away. If you have issue with hyperpigmentation anywhere, definitely consult your dermatologist. But somebody is claiming to make you fair, just stay away from whatever the product is.
Yes, as ma'am said, stay away from the fairness cream, ma'am. We also have a live viewers question. So
Yes.
there is a question from Firoz Khan, and asking how can I get rid of blackheads?
Okay, hi, Mr. Feroz Khan. So, blackheads, yeah, blackheads is again a stubborn issue I know many are facing. So, what we can do is exfoliation helps with the blackheads. So, things like, products which have salicylic acid, then, use them on not on a daily basis, but with, frequent intervals, we can use that. That can help you with blackheads.
Yes, I hope. And there is more questions coming up from viewers.
Yeah.
Puri Mehra is asking, how can I fix an uneven skin tone?
Hi, Miss Purvi Mehra. So, an uneven skin tone, I know it's a issue like many people face. So, what we can do about it is if you need to start up with a skin routine first, have a good moisturizer and sunscreen going, and definitely you can consult a dermatologist. Things like now we've got peels, medifacials, which kind of exfoliate and kind of even out the skin tone. Even micro needling is a procedure which can help you whenever you have issues with uneven skin tone and such things. So I hope it helps. The answer helps.
Yes, and then there's another question from viewer John Verghese asking, what are the most important parts of a skincare routine?
Uh, Hi, Mr. John. So I personally, for me, a moisturizer comes first. A good moisturizer with ceramide comes first, and then a sunscreen, and then at least one active ingredient which helps the skin issue that you've got, depending on the issue you have. Let it be a vitamin C or retinol or any one active ingredient that could help. But a moisturizer and a sunscreen definitely first.
And Ma'am John Verghese is asking, what is the right way to select sunscreen for self?
Okay, sunscreen percent, is it?
Yeah, for self, for him.
Okay, okay, babe. Okay, all right. So a sunscreen, again, it depends on what is your skin type. We can help you with something, we can help. But you can choose that somewhere the SPF, which is more than 30 and which is kind of covering UVA, B, and, also helps with the visible light. So it should be a broad spectrum one which covers, that will help. These things can help while choosing a sunscreen.
Yes, and I hope John Verghese got his answer. Uh,
Answer.
and now, talking about all the moisturizer, we have talked about the sunscreen. How it is important to use a good face wash. Which one to use, and in how many times a day one should wash his or her face.
Yeah. So a face wash, how important it is? Yes, it is important because before, if our skin is not cleared of all the accumulated, particles, so we cannot go into the next steps like, moisturizing or using sunscreen, nothing. So a good face wash is important. And again, it depends on the skin type. Like, if you're oilier skin, it's a dry, sensitive skin. So, it depends from a gel to a creamy wash, or double cleansing if required in case of, some skin types. So that way it is important choosing the right face wash as well.
Okay, and there's question from our viewer. What are the various types of sunscreen, chemical or physical?
Yeah, so there are different types of blockers when it comes to sunscreen. There are physical, chemical, and some are hybrid, which have got both. So all are good, but in particular cases, we feel physical mineral sunscreens are better when you totally, we need to block. So you need to have a right amount of coverage, broad spectrum coverage. So even things which are hybrid sunscreens are also good. The main thing is with the sunscreen is that it has to suit your skin. You should be happy with it. If you're not happy with, the way it is leaving a white cast or it is looking, thick or powdery, so you won't be able to use it. So as much as the what are the chemicals and blocking agents inside the sunscreen, it is also important that you're comfortable with it because we might choose the best one, but if you don't like it, you're not going to use it.
Yes, ma'am, very well answered. So there's a question from a viewer, Suhana Thakur, asking is have a very acne prone skin. How should you treat your skin without completely draining out, especially in the winters?
Okay. Okay. So, hi, Ms. Suhana. The first thing I would say, acne skin, I know, like, people kind of go harsh on it, give heavy face washes, and then, you have to use. So, but face wash should never be like, it should not make your skin like squeaky clean. It should not be like a dry slate. Your face is naturally has to be moisturized. So the face wash also should not be that strong, or that it's making your skin squeaky clean. Face wash which also kind of clears up the impurities and the sebum, but also maintaining your moisture. And second thing, in the winters particularly, as you have asked, a moisturizer is very important, but that should be something which is not causing you new acne, like gel based moisturizers which have a good spreadability. That is a moisturizer you should look for, because whenever the skin is too dry, again you might have new acne lesions coming up. So that is something most people miss. Moisturizer is also equally important in acne prone skin too.
Yes, I hope Suhana got his answer. Shweta ma'am is answering all the questions very well. So there's next question coming up from Kajal asking, influencers talk about many products for skincare. What is the right way?
Yes. Hi. So yes, we have many people talking about skincare. I don't say that all of them are wrong. We hear some good products. Sometimes we hear something that doesn't make sense to us doctors. So the right way is to, you need to see a person who is qualified to tell you what is better for your skin. And you're a right person to choose, like, if it is suiting your skin or not. Somebody on Insta, I don't think is the person who is going to decide the product for you.
Right, ma'am. So there's a question coming from Ravi Soni asking, what are the most important part of a skincare routine?
Yes. So as we have discussed again, the most important parts of your skincare routine are the moisturizer and sunscreen. If you want me to pick one, it will be a moisturizer.
Right. And ma'am, another question is from Rani Jain asking, what should I do about dark spots?
Okay, so hi Miss Rani. So about dark spots, first thing is why the dark spots have occurred is important to know the cause. And second thing, we have lightening agents like which start from stronger things like hydroquinone towards kojic acid, azelaic acid, vitamin C serum. All these things help with the spots, definitely. But also when it is something that has been there, also consulting a dermatologist for things like chemical peel or a laser for the pigmented spot, and sometimes needling procedures. So these will definitely help with along with your routine.
Yes, ma'am. And ma'am, as you said about vitamin C serum, so what is the role of vitamin C tablets and vitamin C serum?
Okay. So good question. Vitamin C is a great thing. You take it, you eat it, you apply it. It's a very good product. So vitamin C is good. So supplements are somewhere like when you're not able to, get it through your food. First thing I say that, get it through your food, increase the amount of, fruits which are having vitamin C and try to get the dose. But yes, supplementing once in a while there is no harm orally. When it comes to topical vitamin C serum, so it's a good product. So vitamin C is a nice ingredient which is going to help your skin. It has antioxidant properties, will help you, although it will balance out all the harm happening from the sun exposure. So it's a good product. So you can use it in the morning or in the night. It can be some sunscreens have vitamin C along with them. You can use them in the morning. That's a great way to start, but it might not suit everybody. So that is something to keep in mind.
Yes, ma'am. And a question coming from Palak, how can I fix an uneven skin tone?
Okay, hi Ms. Palak. So as we have already spoken about uneven skin tone, first thing is falling into a routine, definitely falling into a skincare routine with sunscreen, moisturizer, and any of the skin lightening agents would be a great start, along with in clinic procedures like peels and lasers might definitely help you with the uneven skin tone.
Yes, ma'am. And there's another question from our viewer, Vandana Narvaria, and asking, does hyperpigmentation causes fungal infection?
So Miss Vandana, yes. So I think the question should be, does fungal infection, cause hyperpigmentation? Because sometimes, yes, fungal infection, once it is healed and it's gone, it might leave a dark spot behind. But usually it fades out on its own. Unless, only if it's not happening, then you can consult a doctor for the treatment. But usually that fades away after the fungal infection comes down.
Okay, ma'am. So there's another question from our viewer, Kriti Kapoor, asking, what are the disadvantages of steaming your face?
Okay, so hi, Miss Kriti. So steaming is a good thing when done in a balanced way. So a little bit of steam kind of opens up, increases the blood supply, and then you can have like a fresh looking face. But when you kind of overdo it, it's going to make your skin very sensitive. There is scaling of the skin. You cannot use any product. Your face is getting too sensitive, so there is should be a right balance. So even a hot towel or a warm shower also will do the trick. So you don't have to actually go for long bouts of steam for the face.
Okay, so not like, no, more steaming is not good for
Not
the.
no, yeah, definitely no.
Okay, ma'am. Ma'am, what are the treatments do you recommend for pigmentation or skin glow?
Yes. So the things, for pigmentation, we can start with things called medications, wherein it acts like, mild kind of exfoliation. Chemical peels are a great way to deal with pigmentation. And then once the patient has fallen into a good routine of using regular sunscreens and, his skin routine, lasers are also a great way to tackle pigmentation. They work well. So these are the various ways. Even micro needling kind of helps with the pigmentation. That is a great way to handle the pigmentation of any sort.
Yes, ma'am. And ma'am, what is your take on parlor facials?
Okay. So parlor facial, see, I personally feel there is no, see, the amount of what are you putting on your skin is very important. So there is no point of putting some product and rubbing your face for an hour. Okay, it's skin, like, though you find it very important your face, but it doesn't mean spending 1 hour and rubbing the face is going to do any good. So we need to do right amount of product for the right amount of time, and that is the way to great results. So I think you should think twice before going like to a salon for any
Okay, ma'am. There are questions from our viewers. Shania Sen asking, does olive oil clog our pores?
Olive oil, yes, it does in some people. Some, who have been using from before and it suits some skin types. For the body, it is okay, but for the face, it's going to clog the pores, yes.
Yes, definitely, ma'am. And the next question is from Tina Bhargav asking, which deficiency causes dry skin?
Okay, so hi, Miss Tina. So usually, hydrating is more important. So if it is the constant dry skin you're having, I think the first thing you have to look for more than deficiencies is water. Are you drinking enough water? We cannot tell you like how important to check on your water intake. Other than that, taking a mix, good diet of vegetables, fruits, and less processed foods is going to take care of it. But checking in an adult life, checking vitamin D and B12 values definitely helps. And the second thing is even checking your thyroid levels once in a while. Also, if you have extremely dry skin.
Okay, ma'am. And ma'am, the question from our next viewer, Sonia, is what are the most important part of a skincare routine?
Yeah, hi, Miss Sonia. So, as I have mentioned again, the important part of a skincare routine, the three steps that we cannot miss is cleansing, moisturizing, and putting a sunscreen on. But if I have to pick one, it's a moisturizer.
So, Sonia, moisturizing is very important, as ma'am said, for a good skincare routine. Ma'am, what is your take on home remedies? So many people do remedies for their skin, for their face. What is
Yes.
your take on that?
So home remedies, yes, it kind of like there are home remedies, like even when we talk about hyperpigmentation, things like turmeric with milk or aloe vera gels, like papaya. So these things are there, but it kind of it suits some people. Definitely, it works because these are simple things and they have been used from age-old practices. So there is no harm. But don't use like a lemon directly on your skin, or these things are a little harsh. But something like a papaya pulp, you're using some aloe vera, some milk, or honey. So these things are all right to be used if it suits your skin, because once in a while we see that some people end up having allergic reactions even with these common products. So that way you need to see if it suits you. You can go for these small home remedies, but then it won't suit everybody.
Okay, ma'am. So John Varghese is here asking, how can I prevent tanning in summers?
Okay. So Mr. John, so tanning in summers, excessive sun exposure is going to cause some sort of a tan, definitely. But sunscreen is something which is going to help. Wearing some hats and full sleeved cotton clothes, and having a nice wide brim hat. These are the things which will help. You can stop tanning to a certain extent, and probably also getting the morning time of 10 to 12 p.m. is when you're going to get most tan, 10 to 1. So if you're able to skip that time, getting on the beach or something, that will help. And a hat and sunscreen in your hand might help you with less tanning.
Right. So sunscreen is the most important thing,
Yes,
as you said.
sunscreen and nice cotton clothes, covering clothes, and a hat. And these are simple things which will work always. Like,
Okay, ma'am. And ma'am, can we use over-the-counter plant-based products or organic products best according to
yeah.
you?
So as we say, organic, herbal, these are the terms which are very relative. What is herbal, what is not, what is organic. So that is something, there is no correct definition and people are just using them. So forget the words organic and herbal, like, people are using. And yes, over the counter products, see, we kind of these days we see some good products even over the counter. But what other way I look at it, first you need to have a medicated product to treat you, like, to kind of control the issue you have got. After that, for a maintenance, there are some good over the counter products which can be given for a maintenance therapy, but that way your doctor, your dermatologist will be a right person picking up even the over the counter product for you.
Okay, ma'am. And ma'am, if I ask you about the skin rejuvenation treatment, so what are the skin, rejuvenation treatments?
Yeah. So as I believe in and I keep saying, our skin is very smart. So you don't have to do something. You just need a little help you give to your skin and it'll just remodel itself. It'll just rejuvenate on itself. So that is the basic science behind things like, medifacials, chemical peels, microneedling. So we kind of just help it exfoliate a little, remodel a little, and then your skin is, just as new every day, because your skin kind of like it works every day, every second, and a little help with these procedures will help, your skin rejuvenate on its own. So chemical peels are a great way. Laser therapies are very good. Microneedling is a very nice way to have an overall skin rejuvenation. So yeah, there are various procedures that can be done for skin rejuvenation.
Yes, ma'am, very well answered. So there is a viewer, Tina, asking what deficiency, causes dry skin.
Okay, hi Miss Tina. So as you have asked already, so all the vitamins, like there is no such thing like one thing to pick on. So a general hydration, along with checking your B12 and D helps, and also containing good amount of fat soluble vitamins like vitamin A, E, in food will help. All the good fats are going to help with your skin, and supplementing, with vitamin derivatives is going to help. So good fats are definitely going to help with the dryness of the skin and hydration.
Okay. And, ma'am, what is the treatment for under eye pigmentation and under eye creams?
Okay, so under eye pigmentation is a very common problem, and we cannot treat under eye pigmentation the same way we are treating, the rest of the skin, because the skin on your eyes, around your eyes, is very thin. So we need to use products, skin lightening agents can be used, which have, like, milder amounts of vitamin C, kojic acid, or retinol derivatives, along with some hyaluronic acid and ceramides, which is going to help with, be lighter on your skin, and the serums with peptides. So all these agents definitely help with the under eye darkness and, brightening.
Yes, ma'am. So, ma'am, you have answered all the questions very nicely. Our viewers' questions, all the questions. So, any home message you would like to give to all the viewers watching this live?
Yes. So thank you so much for the time, and thank you for all the questions. I hope I have answered, your queries. I was of any little help to you all. So my home message, take home message from me would be the same as I have mentioned earlier. Your skin is very smart. So just give it a little help, just a little bit of a skincare routine and some guidance from your dermatologist, and it is good. Like, it's good to go.
Yes, and ma'am, patient, I can tell all the viewers that patient visiting Dr. Sai Swetha comes with positivity and are very confident after receiving treatment from her. And Dr. Sai Swetha treatment have benefited many patients. Thank you so much, Dr. Sai Swetha ma'am, for your valuable time. And it's been a very quite informative session for our viewers, and we look forward for many more such sessions in coming times.
Thank you, Ms. Sanya, for the amazing questions, and it was lovely to have you and answer all the queries. And have a great evening, rest of you all.
Thank you. Thank you so much, ma'am. Thank you so much, all the viewers, for an excellent participation. For more information and updated on skin health and care, stay connected on our Facebook page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you all, and good day to all.